I was just 24 years old when I saw a patient die in front of me for the first time. I was working as a junior doctor in a busy A&E department. A 60-year-old lady came in having had a cardiac arrest, most likely a result of a heart attack. The ambulance crew had started resuscitation at the scene, and we continued, delivering drugs, manual compressions, exactly how we'd all been trained. But despite our best efforts, we ended up calling her death. Today, I have 15 minutes to save your life. Or more specifically, I have 15 minutes to help prevent the deaths of roughly 50% of the adults in this audience today who will succumb to preventable lifestyle-related illnesses like heart disease, stroke, and complications of metabolic disease. Lifestyle-related illnesses that cause millions of deaths worldwide and in this country. My name's Rupi. I'm an NHS doctor, and the medicine I'm prescribing today is food. But as more people understand the power of our diets to help prevent, and in some cases treat, ill health, the logical question becomes, Doctor, what should I be eating? And if you've looked at the headlines or scrolled through social media, you will notice meat eaters fighting with vegans, paleo fighting with the Diabetes Association, a war of attrition between multiple sides, with the losers being the millions of people just trying to figure out how best to look after themselves. Today, I'm going to help you with a different approach, because it seems strange to me that you can have some people who decide to eat a plant-based diet and improve their heart disease markers, others who choose paleo and improve their bowel symptoms, while some swear by low carbohydrate and come off diabetes medications. If these diets are so wildly different, how can they achieve such similar and frankly remarkable outcomes? And the reason why is because a lot of the underlying principles are the same. Fiber from whole grains, beans, legumes can contain hundreds of different types of fibers. And these feed your microbiota, this incredible population of microbes that nurture your health by releasing nutrients. They digest food for you. They balance inflammation. They balance excess sugar. And feeding this population with these sorts of foods is critical to maintaining them. Fats, essential for your brain health, the precursors to hormones that curse through your bloodstream. Quality fats that you find in nuts and seeds are incredible for benefiting your health and contain a myriad of different fatty acids. Many bodies, including the World Health Organization, recognize that eating a prudent diet consistent with these features lowers the risk of chronic kidney disease, autoimmune conditions, inflammatory bowel disease, cancer, depression, and many more beyond just obesity and disease. Your plate contains a wealth of information that interacts with your very inner ecosystem in the most powerful way. Nutrition isn't simple for a number of other reasons. Food is an emotive subject. It's how we celebrate. It's part of our culture, our history. Nutritional medicine isn't being talked about by us in medicine because most of the doctors here in this room were not taught about the importance of food at medical school. Our children are not educated in how to grow or cook as part of their schooling, which is why I have patients that can't make the simplest of dishes like oats. And access to healthy foods depends on where you live. The promotion of unhealthy options target the most vulnerable. A real perspective into the grandeur of food beyond just whether something is a carbohydrate or full of vitamins. All health professionals have a role in nurturing a culture that appreciates the power of food. This is how we reverse the tidal wave of lifestyle-related illnesses that threaten to completely expend all NHS resources unless we get to the root cause of what is causing illness in the first place. And many studies point toward diet as the contributing factor. But if we are serious about building the healthiest population possible, where chronic disease is a rarity, type 2 diabetes is uncommon, heart disease affects the minority of people. If we are serious about giving everybody access the best possible protection from disease, then we need to start reforming our food systems and our food environment. Making food as medicine not a cute or quirky concept, but the norm. Elevating nutritional medicine into a recognizable mainstream concept in the pursuit of a proactive, healthier population, affiliating all GP surgeries up and down the country with community kitchens, and investing far much more research into nutrition. I've talked a bit about how food can prevent disease. I've talked to you a bit about how complicated this food environment is and our little way of mitigating that. The opportunity of having the biggest impact on your health is actually in your hands. It's not with a blockbuster drug. It's not with a new pioneering surgical technique. It is with the simplest solution. It's how we feed ourselves. And I'm hopeful we can generate a food-focused approach to health in our communities instead of reacting to disease in our emergency departments. Thank you.